Welcome to the Goddesses of Social Work podcast, hosted by Renita Ray Davis, licensed clinical social worker, board-approved social work clinical supervisor, and facilitator of the Goddesses of Social Work supervision community. Join us as we travel through the social work journeys told by the Goddesses of Social Work community members, past and present, as they make their way toward clinical licensure.
Welcome to the Goddesses of Social Work podcast. I'm your host, Renita Ray Davis, and we're joined today by Whitney Anderson. This episode is part of our Remember Me special series, where we're highlighting the incredible work happening behind the scenes at the Central Alabama Aging Consortium as we prepare for our community gathering and film screening on November 1st. Whitney Anderson is a graduate of Auburn University Montgomery and brings almost 20 years of experience working with Medicare, Medicaid, and other insurance programs. Her background includes training medical billing professionals on Alabama Medicaid and working extensively in medical billing across hospital, physician, anesthesia, and durable medical equipment settings. For the past 2 years, Whitney has served as the Central Alabama Aging Consortium as the coordinator for 3 vital programs: the State Health Insurance Program, SHIP, the Medicare Improvements for Patients and Providers Act program, MIPPA, and the Senior Medicare Patrol program, SMP. Through her work, Whitney is deeply committed to helping seniors navigate complex systems, advocate for their rights, and access the resources they deserve. Outside of CAAC, she serves her community through her church and other volunteer roles. Whitney has been married to her husband, Jordan, for 14 years, and together they have 2 children. Whitney, we are so excited to have you here today. Welcome to the podcast.
Thank you so much. I'm so excited to be here.
Yay! Whitney, before we hit record today, I was talking to you about some of your other extracurricular activities that aren't on your bio. And I told you that you are the second person in like a 2-week span who's told me that you played volleyball as an adult right here in Alabama. I was curious, like, how do you get into that? And like, what type of impact does that have on you?
I think that I got into it because I wasn't ready to be done playing sports. I played all through school and I loved it. It also gave me an excuse to eat what I wanted because I was exercising. So I enjoyed that I could still play. It also gives you a chance to meet new people. I played in a league in Montgomery for volleyball and also for softball. And it just gives you a chance to meet all kinds of new people. It gives you a chance to make new connections, build relationships. And it's just a lot of fun to have still be competitive and still compete with other people. So it was a good time and I really enjoyed the time I got to do it.
I love that. Whitney, you know what? You just reminded me. My son asked me, because, it's football season, y'all.
Yes.
It is football season. And, I was talking to someone who's not from the South or even Alabama, and they didn't understand why football season is so important to us. But my son actually was asking me, he's like, Mom, how did you even get into football? And I said, I've always been super competitive, and that's just an easy on the couch way to be competitive. And so when you were saying it keeps the competitiveness going, I was like, yeah, I love that. But I also, is this a women's league or is this a, co-league? Do all people?
I played in a women's league.
Okay.
They may have a co-ed league now because it has been a little bit since I played. But for volleyball, I played in a women's league, and then for softball, I played both. I played a co-ed league and a women's league.
Do you need to know how to play volleyball well to be in the league, or is it more for fun, or is it truly really competitive?
I think if you want to play for fun, you need to be brave because some people are going to be coming from where they're still playing competitively, and you need to be prepared for that.
I love that. You need to be brave. So this is not just for fun. This is for winning. This is truly for winning.
I mean, all of us want to win.
Yeah, we all want to win. That is so true. Did you win many games when you played?
Not the first year.
But were you really brave?
Yes.
I love it. I love it, Whitney. That is so good. So I'm going to start light with our questions for the interview today. I'm always so very curious about this. What did you want to be when you were growing up? And or who did you most admire?
I had two things because they kind of changed. When I was originally, like when you're little and you're going through elementary school, I really wanted to be a veterinarian. Then I went and volunteered for one when I was about 14, and I decided I didn't want to be one anymore. Um, I had this old lady's dog that had a broken leg because he jumped off a couch, and we were having to fit his cast, and he pooped on me. And I said, no, no more. Then, as I got older and my relationship with the Lord developed and just seeing other people, I really wanted to still be able to serve in some capacity. But I wanted to do it on the medical side, on the clinical side. I wanted to be a physical therapist. I actually got into PT school and didn't go. I got married instead. But I think when I was growing up, my family's really big. There's a lot of us. And I'm surrounded by a lot of strong, God-fearing, Jesus-following women. And some of them are loud and strong, and some are quiet and strong. So I got a good mix of women to look up to. And so I think all of them had jobs that were service related. I actually grew up in this agency. My mom worked here for 28 years and retired from here. She had actually one of the positions she had is the one that I currently have, so that's kind of cool. I go to her, I'm like, I need help, and she still remembers. So it's been really cool to have that kind of legacy with her, to share that bond with her, with that relationship. Um, but I just kept trying to get on the clinical side, and God kept saying no. So I kept ending up on an insurance side, and I guess it's because I like to problem solve. And I love an underdog. I love to go to bat for other people. I'm your first person when you go ride or die. I'm your person. And so I think ending up on this side where I get to help serve and fight for people who can't necessarily fight for themselves is a big deal.
Whitney, I am loving doing these interviews because the stories you guys are telling, I'm like, what? What? So you are your mom, you are a legacy at CAAC. I know that in November it will be 50 years, 50-year anniversary. I've been hearing
Yes.
that a lot. And so the fact that you grew up, I love that you're saying that grew up in that agency and now hold a position your mom once held. What an amazing legacy.
It's so cool. I love it. That's probably one of my favorite things to tell is that I get to help do something that she did.
You get to carry that on. Yeah. I'm wondering, I have a kid who is also a social worker, and often I'm in my head about it sometimes. Do you feel, I have 20 some odd years on her in this profession, and do you feel like those are big shoes to fill? Are you honored to tell me more? Yeah.
Hers are definitely big shoes.
Hmm.
My mom and I have very different personalities. She's still outgoing and she loves to meet people, but she is not as loud as I am, I guess. And so her strength and her leadership is very different. And it took a long time for me to understand that. Just growing up in general, being up to that standard, because you always want to be that way. You want to make where people can look up to you and trust you. And that was a big deal for me. So when I got this position, I was really excited because I want the opportunity to kind of do what she did. And because I had already learned some of the stuff that she did that didn't work and things that maybe were not the best routes to go. And so kind of already having that being up on that and knowing that was really, really cool that I wasn't drowning to start with because I had the background with her.
And I love that you also have her wisdom that you're able to lean into when you get stuck with one of the programs. And you run, I'm one, of course, you'll correct me if I'm wrong. And we're going to talk about these programs in just a moment, but you run some of the larger programs in this agency as well, right?
Yes, one of them is definitely one of the larger
One of the
ones.
larger ones. And so to be able to lean into her wisdom in a way that other people don't have access to has got to feel very, very fortunate for you.
Yes, I'm very blessed to have that. I
Hmm.
would almost go that I'm a little spoiled because of it.
I love it.
Um, because I can just I can send a text. I can make a phone call and be like, I don't know what I'm doing right now. Can you help me? And she's there. She's awesome.
And the agency is really blessed to still have her connected through you doing that as well. So that's thank you, Mama. We love that. You can we give her a shout out? What's her
We
name?
can. Her name is Susan Segrist, and
Yeah.
she's currently enjoying retirement.
Good for her. I always am so grateful for the women and men, but mostly the women. It is the Goddesses of Social Work podcast. I'm always grateful for the women who came before us, who paved the way to do this work. And this is a literal way that a woman who came before us paved the way for you now to be doing this work. And so we honor her. Thank you, Miss Segrist. That's pretty cool. You already kind of got into how did your path lead into this, but can you expound on it some more, because you said you wanted to be on the clinical side but you ended on the insurance side, which I think is harder actually. How did start from the beginning, and how did you get here?
So again, like I said, I have a really large family. And so when you have a large family, you have a lot of contacts. So when I was in high school, I started working for a physical therapist who was local to our area. His son was dating my cousin. So that's how I got in. And I learned all the clinical stuff. But because I guess was versatile enough, they were like, oh, let's throw her on this side too. So she can help, in both ways. If we're short staffed, she can jump between places. So I went from folding towels and helping people with exercises to running insurance eligibility, making folders, learning how to schedule different things. And that went on for a few years. I worked for him all through high school. Got into college and actually started in Mobile and I worked at the cancer center. And ended up helping their research department. So there's a lot of meetings with like Pfizer and these different drug companies. And so it was really cool. I would get to make these, I really got paid to make binders. And it was great because I was 18 and poor. But we got to learn all these different things. And I was like, oh, this is really cool. And like, this can still help. And as I got older, it just kept being, well, you're the one who understands this. You're the one who can figure it out. And we really need you to do this. And the older I got, once I kind of got more into the admin side and insurance side, it was okay, I can do this. I'm never going to be bored. I'm always going to have to pay attention. And that was a big deal for me because I don't want to be bored. I don't like being bored. I have to be moving. So now my brain is never not bored. It's tired most of the time. But it's because I'm getting to learn these things and continually make sure that I'm up to date on those things.
I love that. I was literally thinking about boredom this morning. So the fact that you're bringing that up, like never be bored, but now we're overstimulated. Yes, but I want to go back to something. You were in high school when you entered this profession. Is that unheard of, Whitney?
I have no idea, to
Yeah.
be honest. I have a lot of friends that didn't know at all what they were going to do, and they tried all different jobs. And I knew I never wanted to do retail, and I knew I never wanted to do food because I knew that I would get fired. Um, so I always was a little different than everybody else. They always worked at like their parents' jobs or they did other things, and somehow I just knew that wasn't what I was supposed to do. So it's interesting that our society is all about degrees and all about having these things, and a lot of them are degree specific, but my degree has absolutely nothing to do with what I do. Um, but I've been doing it for so long, and I understand it, and I understand how the changes work, that it's been really beneficial.
Absolutely. Now you got me curious. What is your degree in?
Exercise science.
Yes, I love it. And that's how you got into PT school. I see that. Does that dream still sit with you, or do you know that you are firmly grounded in what you're doing now?
No, I don't want to do that anymore.
Yeah, that's hard. That's,
Plus the extra 3 years of school I'd have to go back into is a little downer. But I think some of it I've learned, and I have a lot of friends and family who are physical therapists. But one of the things I've learned is it's a little more repetitive than I thought it was. So,
the PT
and even
stuff is, yeah,
like
okay.
even if you have different clients and different patients, an injury has very similar exercises still. The process is still very similar. Where it's individualized, it's not completely individualized. Unlike insurance, which is very individually needed to suit needs. So
Absolutely. I'm also rereading your bio, and it says that you train medical professionals as well on Medicaid. How does that show up in your work? Is that going to show up in the programs you do, or was that something separate?
it was separate, but it has definitely given me the tools to do a lot of different things now. Alabama Medicaid has a contractor that handles all their claims and processing and eligibility and all that stuff. And I worked for that contracted company. And one of the jobs was they were called the provider reps. And so we would handle like complex issues that a traditional call center couldn't answer. If they were having claims, billing issues, if they had new staff come in, we would go in and train them on how to understand what Medicaid guidelines were. We would go in and train them how to use the provider portal. And it would be all different types of providers. It would be hospital specialists, primary care, dental, vision, all of those we had to go see. And we would have to cover the whole state. So there were, I think, 13 of us at the time that we covered the whole state between the 13 of us.
And I know Medicaid. Medicaid is complex. And not only, so it's not even that you just niche down into one area. You covered all of because I was like, so what kind of providers were there one-on-one? But you're in hospital clinics, all of it. That is a very, very wide range of knowledge you have in that head of yours.
Well, some of it's kind of died off because I haven't used it as much. But some of it I've really kept into, and it's been able to help me understand when I'm explaining things to other clients. And some things I learned working for them that I can pass on to clients now that may not necessarily be strictly related to what I do, but it's an extra resource that I can give them to help them.
Now, Winnie, I don't know much about insurance at all, but one of the things that as a social worker, I find myself doing a lot is telling my clients and or the social workers I get to serve to contact that number on the back of their insurance card in order to find out what their benefits are and what resources are available to them. I think people, they're just like, go to the doctor, go to urgent care, go to the ER and have your insurance card. I don't think they realize how many benefits are available. And if they never call and or go online, I know most of it's online now, but still just calling and talking to a knowledgeable person about what benefits are available to them can open a whole world of health quality that they didn't know was available.
Absolutely, especially with the clients that we serve. They provide a lot of wellness benefits. A lot of the plans that I deal with offer, they're called generally like a silver sneaker benefit. So like if you wanted to join like a YMCA or something like that, you would get like a discount on your membership to encourage you to go and participate and be active, which in turn helps every other thing that you're having to go to the doctor for. So it's a really good resource that not a lot of people know. And it is something that I tend to do a lot of explaining when we do one-on-ones.
And that's such a great segue into telling us about your program. But can I have a little pause here? Because I really want to say this. You said you're the first person to call if you need a ride or die. And I want to attest to that because the first time I met you, it was at the CAAC breakfast, and not everyone, but there was a lot of your coworkers who are also coordinators over other programs. They were getting up to speak. And what we know to be true is public speaking is, a lot of Americans' number one fear. And I heard you, Whitney, which is why I was so excited about, getting to work with CAAC. I heard you in the background, like cheering people on, like, you can do it. See, that wasn't so bad. You did such a good job. And I am such a cheerleader that I was like, who is this person cheering 18 other people on? And so when you said you were ride or die, I was like, yeah, I saw that firsthand. You are ride or die. You were cheering everybody on.
I think it's my big sister syndrome too.
I am a big sister too. I think we both said we were cheerleaders when we were growing
Yes,
up. And I'm a big sister. And when you said that, my sister, she literally texted me a little bit ago. And I was like, you can do it. You got it. And so I loved
yes.
it. that you're a big sister to all those beautiful, amazing women who work with you because I really enjoyed watching you cheering them on. But now, taking my little pen out because I wanted to make sure I said that. Um, you coordinate three major programs at CAAC, and I'm just going to say SHIP, MIPPA, and SMP. You can tell us
Yes.
what those are again, but can you walk us through what each one of these programs does and the unique roles they play in supporting older adults?
Sure. So I'm going to start with SMP because it's a little more separate than the other two. They're more related. SMP is Senior Medicare Patrol. Um, Fraud is rampant everywhere, but Medicare fraud is growing exponentially. It's something that it's easier to take advantage of with seniors, especially since COVID hit. Um, everybody does stuff through the phone. Everybody does stuff online, and that makes it a little more dangerous. Unfortunately, our older population are more trusting. They're not as cynical as some of the rest of us, and they want to believe the best in people. And unfortunately, that gets them taken advantage of. And so, what we do with our Senior Medicare Patrol program is a lot of education. Anytime we go out to speak, whether it's me or even just another coworker who's going out to speak about our services, the big key is to tell them to be aware, to be prepared, to know who to give your information out to, your Medicare number, your Social Security number, your birthday. Um, Big things like that, and also even protection from some of our healthcare industry where those few bad eggs make everybody else look bad. Reviewing your claim notifications that you get. We as private insurance people, we get like a claims notification on our phones. We can check it anytime. And with Medicare patients, they normally either get them in the mail or they can check them online, and they may not do that. But you may have somebody who's billing incorrectly for you, and you may owe money for a service for a test that you didn't have done, or they may be trying to convince you to have a test done over the phone that is never going to be done over the phone because the doctor has to write a prescription. So a lot of education. Um, Now, once that education's been given, and if something happens, they can still call our office. They can still get in touch with us and go, hey, I believe Medicare fraud has taken place. This is what happened. We review it, we investigate it, and then we have great relationships with other agencies like the DA, the Securities Commission. We have an elder law attorney. We have all these different resources where if it is that way and it does need to be escalated, we can help at least guide them through those first steps of the process before they go to someone else to keep passing it on and to keep helping them out. But that's basically SMP.
Before we move on to the other two programs, can we pause and just lean into SMP? When I heard the word patrol, I was like, that's an odd word for a program. But now I'm like, it truly is. You are patrolling, or the work you're
Yes.
doing is patrolling to make sure that people are kept safe with their medical benefits. I don't know if this is an example, but I'm wondering, a lot of times, especially at the gym or something, I'll see the commercials, call 1-8 because of the Medicare Part A, B, C, and D. And then is that considered? I know some of them are legit, but is that just miseducation because people think they have Medicare, or is that part of the fraud part?
Is not necessarily fraud. Some of it is just bad marketing. Um, or it can lead into fraud at times, but most of the time that is more of I'm trying to sell you something that's like Medicare plan related. Um, Generally, what we're talking about with Medicare fraud is somebody using their Medicare number to buy a $14,000 power wheelchair when they're not the ones getting the power wheelchair. Using their insurance to pay for something that's not theirs, um, or getting them to pay the copay for something that's not theirs. It can be, there's a lot of different scams going on, especially just for seniors in general. A lot of phone scams, trying to convince them to do like genetic testing over the phone, saying that it's covered and how it goes. And yes, it can be covered, but it's never done over the phone. So things like that, a lot of the commercials are more advertising, choose our plan, we're great for you, we'll take care of you. And that's more a marketing issue that I have. It's not necessarily to those plans specifically, but their job is to sell insurance. So my job is to make sure they're protected from either that insurance or from people who are trying to take advantage of their insurance.
And we talked about you running some of the larger programs at CAAC. Is this one of those large programs?
No,
Okay.
surprisingly, it does get included a lot in the SHIP program. The three of mine are separate programs, but they are interconnected. They're all siblings, if you want to go at that route, which is why one person has all three programs because they're so intertwined in each other. The importance of knowing your Medicare rights and of knowing what to look for goes in choosing the right plan. And there's lots of different things that make them interchangeable. So it's good that I have all three because it means I can just take all three with me where I go. The MIPPA plan, it's a great program because what it does is it allows for us to um, check every client that comes through our office that's Medicare eligible. It allows us to check to see if they can receive any extra assistance with Medicare costs. So when you get Medicare, you have your Part A, which is your hospital. And then you have your Part B, which is all your doctor's offices, ambulance, things like that. Well, the Part B has a premium that you pay. That's part of your cost share with the government. And a lot of older individuals, especially older women, who did not work jobs that paid lots of money, who did not work years and years and years and have that kind of Social Security check, paying at 185 every month is very straining and very stressful. And this program, the MIPPA program, allows for financial qualifications to assist paying that premium. So, there are different levels. The basic level is it pays your premium and it helps drop the cost of your prescription drugs. And then the most help you get is it basically acts like a supplemental insurance and it goes through Medicaid. It pays the premium, it pays the deductibles, it pays your co-pays, it pays your co-insurances. And it's a great, great, great program for people who need it. Because if they don't know to ask for that help, nobody's just going to offer to pay your Medicaid premium, pay your premium for you. So what we do, I do it specifically. We have a resource department that helps me tremendously. They'll screen every single client that comes through, even if it's not for my program. They're going to screen them to see if they have Medicare and if they need me. And so the MIPPA program goes in with the SHIP because it is directly involved with Medicare. Does that make sense?
Okay. Almost makes it because we're starting with S&P. We're going to make sure
Mm-hmm.
we're not getting fraud. Then we're
Mm-hmm.
moving up to the Medicare Improvements for Patient and Providers Act program, which is the MIPPA, that
Mm-hmm.
says, okay, now that you're not frauded, we're going to make sure we pay for your deductible and copays and any prescription to try to get them on a
Right.
lower
Premiums,
cost
all
for
that.
you.
Mm-hmm.
Okay. And then the overarching program then is SHIP, which is the state health insurance program. Am I following you?
Yes.
Okay, go with that. And can I
Okay.
say I want to make sure we come back to something you said with the MIPPA program. So let me make sure I do that. Okay, go ahead.
Okay. I'll try to remind you. Um, so for SHIP, the big thing is it's for anybody who's on Medicare. You don't have to be 65. If you came into Medicare because you went through the disability program, if you went through your 24 months of disability and are now on Medicare, I can help you. If you, the other way to qualify is other than aging in is to have ALS, which is Lou Gehrig's disease, or stage 5 kidney failure, which is end stage renal failure. So if you're in because of any of those reasons, you're eligible for me to help. And basically what we do a couple of things. If you're coming into Medicare new for whatever reason, I can help you find the prescription drug plan, which is that Part D. help you find that plan that's best suited for your medication. If you don't want to just do the drug plan, if you want to have the complete package where everything is under one card, you can get a Medicare Advantage plan. That's under Part C, so C is for complete. Um, that's how I have to explain it to most people. It makes a little bit more sense that way. Um, and that includes your hospital. Anytime you would go to the doctor or see any kind of medical professional, you would give that one card if it's a Medicare Advantage plan. And that is a little more in depth when we do those. It checks the pharmacy, you check your prescriptions, but you also need to check what your out of pocket is going to be for those specialists, for that vision, for that dental, for your hospital visits, for your x-rays, for all of these things. And we go through an actual program through Medicare. It's medicare.gov, and it allows us to put all your information in that is specific to you. You have your own login, you can have your own password. It's something you can keep as an individual. I don't ever have to have access to it unless you give it to me. And basically what it does is it allows us to run what's called a comparison. And the comparison lets us put the top three plans that are for your needs that the system has pulled based on their algorithm. That's way above my pay grade. And it lets us see them side by side. So I can look at Humana, I can look at United Healthcare, and I can look at Blue Advantage all together on the same page and be able to compare side by side what each one is going to have me pay for what service. And that's a big deal because a lot of people want to know, well, what am I going to have to pay for? How much is it going to cost me? Am I going to be able to afford it? And the answer is we're going to find out. And it is very individualistic. I have husbands and wives who don't have the same plan because they don't have the same health. One can be super healthy, one cannot be, or they can just be on totally separate medications. That makes a big deal. But my job is to just make sure that you're on what's right for you. The bonus to me not being a broker is that I don't get paid to do that. My job is to be unbiased, unless the only bias I really have is to get you what you need. It's about you, it's about the client. We'll also help during coming up is open enrollment. So there's a yearly change that you have that you can do for Medicare, and I will be busy. And what we're going to do is just check to see, is the plan I'm on now, is it going to be good for next year? Or do I need to look at making changes? We can also help. One of the other things, it's not quite as common, but we can also help if you wanted like a supplemental plan to Medicare. If you wanted to pay out of pocket for that plan, we can help you find one of those. And they also are the same way where they have extra benefits that you may or may not want. And basically, my job is to make sure that you are taken care of on the Medicare front as well as I can take care of you. Making sure you have the plan that's best suited for you that you can afford. And if you need that help with that premium assistance to see if you qualify, um, and there's even programs that we can look at that are even just pharmacy assistance. Like if your income's a little too high for the premium assistance, maybe you can still get help with your pharmacy cost. But I look into all of that for you. You don't have to do the work. I will do it for you. And we meet in person. We meet over the phone. I will sit with you through whatever you need me to sit through, and we'll figure it out.
This is such an amazing program. Such an amazing program. But I have a couple of questions. How does one even know that they need to come and talk to you? Is it only when it's early Medicare approved, or what if they've been on Medicare for years and are struggling with all the things you just talked about and didn't know that this was even available?
So if they are struggling, a lot of time the way that our office communicates is through word of mouth or through some form of advertising or through just outreach, community events, things like that. But my grants are federal grants. So they're based and managed by the governing body for Medicare, which is CMS, and by Medicare. So I have referrals from Medicare. I have referrals from the Social Security office because they handle the initial, hey, I'm getting into Medicare, but now you're in it and that's not me, and they'll send them to me to help and do that as well. So it just kind of depends. Some people have never known we existed. Like I said, we're about to celebrate our 50 years, and I've met people who have no idea this agency exists. And I'm like, how do you not know? Yes, how do you not know? but lots of people don't. And I think the reason is because a lot of our population are aging. And when you're not aging, you don't pay attention. Or when you're not sick, you don't pay attention. And it's not until you're in that storm that you feel like you're drowning and you go, I need help. And that's when people find us. And it can be through friends, church. Like I said, you can use the actual agencies, Medicare, Medicaid. I have great contacts at Medicaid, the Social Security office, things like that, or social workers. That's the thing too, is getting your case managers and social workers to understand that they have free help and that I'm not going to charge them. I'm not going to make them go choose this plan over this plan. My job is literally to advocate for them to get the best plan.
I'm so glad because I was thinking social workers, they need to be able to refer to, and it would make their job so much easier too, especially if they're able to alleviate some of the, because I'm thinking 185 with your MIPPA program, paying that deductible or that monthly fee, $185 for someone 65 and over is groceries, it's food
Or
for
a
them
power
to
bill.
power, yeah, yeah, and so being able to alleviate this cost in order for us to provide service over here is so important. I I wanted to go back to the MIPPA. I know you were going to remind me, but I wrote it down.
I'm so proud.
Yeah, I know, right? You said this ADD. You said, especially women who didn't work a lot and now didn't get that big, aren't getting that big Social Security check, and that 185 is a lot because what is it, 880 that they get, and so
They can
180.
get, I mean, anywhere the max number that you can make gross. So that's before that
Mhm.
185 comes out. So the max you can make as a single person is less than $1,800.
Wow.
And a lot, and it's not something that people think about, but it is something that I see here where we are locally. Um, is that a lot of the older women did not make that kind of money. And if they're married to their spouse and their spouse made enough that they can survive, that's great. Or if their spouse is deceased and they can pull their benefits, that's great. But that's not always the case. And so we've really tried hard to, again, they check everybody, but I have a special spot for for older women. My grandmother was one. Her husband passed away, I mean, before my parents even got married. So that was years and years ago. And she lived years and years by herself. And she worked for years by herself and took care of all these children and did these things, but she didn't make enough money to pay that premium every month. Now at the time, my mom was doing this program. So my mom knew to help her. But there's so many women that age that are anywhere from 65. I mean, I have a client who's 90 and she's just now getting on this program. And just for us to be looking for ways to help them is what I really enjoy about what this program does. Because and with the extra medical and insurance knowledge that I do have from all these other jobs, is that I can look for other ways to help. There are little tidbits that you may not know when you get a hospital bill of how you're going to pay that bill. But I know because I did it. So I can give you that extra information and you can keep it to yourself and use it, or you can pass it on. And it becomes a great way to help protect people and to make them feel protected because they know that they're getting what they need and they know that they have somebody who's got their back.
Absolutely. And I'm thinking too, about how can we get the word out? So so what does that look like for you? I heard you say you're doing outreach. What does the outreach look like, and how can we help getting the word out?
So we actually have an outreach coordinator now, which I think is one of the best things we've done. Now, all of us coordinators have to be trained at least to be able to give information on every program. But again, my programs are a little more complex. And once you get to talking about it, people ask questions. So generally, if they know Medicare is going to be going on, they're like, Whitney, will you please come with us? Yes. But we do a lot of health fairs. We'll do health fairs. We set up tables. We serve in the community even. We've helped with food pantries, with any of that locally. We've met with our senior centers are a big thing that we have access to. And old people like to talk and they like to gossip, whether they admit it or not. And so getting with all these people and helping them understand that there is a free resource for you for all of the different things, not just mine, but for all these different services, is basically how it's been. We've used TV, we've used radio. Um, we will be using TV for open enrollment. We have a social media that we're really trying to build up in regards to Facebook, YouTube, our actual website, things like that nature. Luckily, I'm not in charge of that. I just have to talk when they tell me. Um, but that's generally what it looks like, is all the coordinators have to know enough about another program to be able to talk to you about it. We have to be well-rounded. So that's generally how it's done, though, is through some form of word of mouth.
I love it. And I want to brag on y'all's website. I've been on it a couple times, and my sister, she's been on it, and she even screenshot. Y'all's website is amazing. And we're going to
Thank
make
you.
sure that we have the link to your website in your podcast description, so people can not just get to find you there and you can help them, but also the other programs that are there as well. I was thinking, Whitney, churches too is probably, because I know you volunteer in your church. Is that something that's even because it is a federal grant? Are y'all able to go into churches and do
Yes.
outreach?
Yes, I've actually tried to and have been successful in some. Go actually, a lot of churches now have senior groups because they don't necessarily want to go or are close enough to like a senior center or something like that. And they have their own groups within their church. And so we've gone to those throughout our counties that we serve. And they're some of the funnest people. They're like one of the groups that we went to, they were literally called the Senior ADY, and it was Ain't Done Yet. And I loved it. I loved it because it meant that even though they were older, they weren't done serving. They weren't done living. And so when we got to go speak to them, they were very receptive and they wanted all kinds of information. So yes, going to churches is definitely okay. And we love to do it because they normally feed us too.
Good food. Good food.
Absolutely.
Yes. Whitney, I have written down, I'm going to tell you about it off camera, but I'm like, I have some ideas. I can't, I, I know you're going to be busy during open enrollment, and we want people to come and see you, even if they know you're going to be busy, because that's a very particular time you can help them. But
Yes,
after open enrollment, I'm like, Whitney, can you come? Can you come talk to my people?
absolutely. I love to
Yes.
talk in case you can't tell.
Oh, I love it. This has been so informative. It really, really has. And so you kind of touched on it, but I'm still going to ask, what does it look like to advocate for older adults navigating complex systems, for their access and for their protection?
For me
Mm-hmm.
specifically, it's a lot of going to bat for them. One of the things that the SHIP program does do is like I can help explain medical bills if they are questioning it. So like again, that's a combination of the SHIP program with your Medicare and the fraud because you want to make sure that it's correct. So again, they're kind of interchanging, they're crossing lines together. I have a lot of billing experience. I have a lot of medical knowledge in regards to how things should be billed and coded. I'm not a coder, I did not do that, but I do have a lot of experience with it. And so I can maneuver around a bill, and if I don't know the answer, I'm very good at calling and finding it out. I normally have clients come in because at that point you have to have permission to talk to me. But they'll come in with me and we'll look at the bill. And if I question it, we'll call, whether we start with the insurance company first to go, hey, is this correct? And then if it is or isn't, sometimes we call the doctor's office. And I've actually had some that like we have to actually do the appeals process for them because the doctor's office is kind of stuck. They can't get it appealed and get it paid. And they've tried. So I've done that for somebody. I think just knowing that somebody can walk them through or even just understand what they're complaining about is a big deal. And I've recently learned that even Medicare has somebody that they can go to if I can't do it. So that was really cool to learn about. But I think the biggest thing to help them with complex systems is one, letting them know that somebody cares. Because insurance is hard and it's dry. It's not exciting and it's not something that everybody wants to talk about. But I will listen to you complain to me about it. I will help walk you through what we're going to do about it. If I have a suggestion on how we can make it easier, I will tell you. And if I don't, I'll just hold your hand. But I think that with us, it's always been the top thing is that you're serving them. That's what you're doing. And I don't like people being taken advantage of. I don't like a bully. And hence the ride or die. And I will be the one to go with you. If you need me to help hold your hand and let's figure this out, let's figure it out. And I think that just having somebody who has enough knowledge and enough drive and enough heart to do that with them is a big deal.
I love how you are continuing the legacy of the women in your family. How, because sometimes, because for some people, this could be a job. It's just insurance. It could
Mm-hmm.
just be a job. But you see this as serving our elders. And you started this interview off with the women in your family are servers. They have a servant's heart, whether it be loud and or quietly serving. And I think you are showing us today you are a good combination of both. You're like, oh, you're being taken advantage of? I got you. I'm calling right now, but also quietly sitting and just holding space so that somebody can just complain about this complex system. And even if there's not anything you can do, you at least sit there and hold space with them and hold their hand. And so showing up with such a beautiful servant's heart is such a beautiful legacy to all the women in your family.
Thank you.
Yeah. I'm curious, Whitney, is there a particular story or moment that reminds you why this work matters that stands out for you?
Yeah, I have two. One of them's more funny.
You
This
are
lady
funny,
came,
by the way. You're
thank you.
hilarious.
Well, you have to make insurance a little less dry. I have a client who came in and she came in for open enrollment last year, and she said, I don't want to change plans, but I don't want to pay this much money for my medicine. Okay. And I was like, well, if you're not going to change your plan, you have to change your pharmacy. She goes, okay. So she gave me a list of what was around her, and I went and looked. We ran the comparisons to see how she would save money. And we found one, and it was actually going to save her $6,000 a year to change pharmacies. So she was thrilled because she didn't want to change
Look,
plans.
I don't even know who she is, and I'm thrilled with her. My
She
goodness, $6,000?
for the year.
Wow.
She had a great medical side of where she was at, which is why she didn't want to leave. And so we did the work and we looked, and that was what we found.
I
And
Congratulations. And that was a pay raise for her. That was
it
a pay
was,
raise. Yeah.
it
Congratulations on
definitely
doing
was.
that.
I have another one. We have sweet, sweet, sweet people who call us in to come talk every year. And I was brought in later because again, I haven't been working here as long. And so again, it was about Medicare and nobody wants to talk about that. So Whitney gets to go. And I went and talked to this HOA that was a meeting that they were doing. And so we went and spoke and had a couple people like, oh, I'm gonna call, I'm gonna come. And I'm like, okay, great. Maybe they will, maybe they won't. Well, this lady came and I helped her. And then she sent somebody here who had not been at the meeting. And she had a lot going on personally, as well as with her insurance. And we weren't able to save her $6,000, but we were able to find what worked for her, what did save her money. And she left here just crying. And she's like, nobody's ever done this. And I'm like, that broke my heart. And I think it's really cool that you get the funny side where people are like, this is what I want, and this is how I need you to help me. And then you have some that are just so grateful because they didn't expect the help. And that's what I think is really cool.
I'm so grateful too. I am. And I want to say thank you for doing this work. And thank you for doing it with such a joyful heart. Because, there's that. So thank you for
Sometimes it's
doing
not joyful
I hear you.
when I'm trying to find the plan, but once we found it, we're a little more joyful.
And once you're back in front of your person, oh, it's full of joy. We're full of
Yes.
joy. Yes. I love it. So thank you for doing this work. Brittany, one of the reasons we're doing these podcast interviews is we're doing a special series, Remember Me. which is a documentary about a family who is processing a loved one who was diagnosed with dementia. And we're screening it at Central Alabama Aging Consortium on November 1st. And part of that screening is also a community gathering where you all, the 18, the women you were cheering on, are also doing a resource fair to, give more information about your different programs, talk to people face to face. What are you hoping people will get out of this event on November 1st?
One, especially with some of our other programs, is that caregiving is hard. And it's a lot of weight. And no matter if it's a dementia diagnosis or heart failure or any of those diagnoses, it's always going to be hard. And it's okay to ask for help. And it's okay to ask for somebody to help with that load. And our office is here to help with that load. And even if it's little things, like we're going to get your Medicare plan fixed so your drugs don't cost an arm and a leg. Or you have a medication that you're on for your condition that's not covered and you can use another program. Or you need help in the home and you can use a different program. Just the ways that we can assist you in caregiving and to help take that burden and to give you some peace of mind and just truthfully give you a break. And because sometimes the people you're caring for, they want a break from you too. And so that's okay. And so I think with all of this that's going to happen, especially with that documentary, is understanding that it's okay to have a village help you. And it's okay to depend on that village and that you need to be open to who's a part of that village.
And the CAAC is part of that village.
Hopefully, yes.
Yes. Yeah. Now that aging is, if you woke up today, you are aging, you need to know what the CAAC does. That's what I've been learning in regards to doing these interviews. So this was an amazing interview. I'm smiling. My cheeks are hurting. And I just have loved, you are hilarious, Whitney, which was a pleasant surprise. I love that. But, we've been talking about complex systems and trying to navigate. I think I was telling you, we have these degrees, we've been in the field forever. And even when we go into these medical systems, it is difficult for us to navigate.
Yes.
And now that we're talking about elderly and tech issues and all of that, I can only imagine how difficult it is for families and people to navigate. So I just wonder, is there any final words of advice or guidance about advocating for themselves or loved ones as they're navigating complex systems?
I think the big thing is to don't be afraid to advocate for yourself or for your family.
I love that.
It's okay to ask questions. It's okay to make them explain it to you. It's whether it's a diagnosis, whether it's a bill, whether it's what your Medicare plan is, whether it's what your services are going to look like because you're in the home. It's okay to do that. And if you're not comfortable advocating for yourself, make sure that it's okay to ask somebody else to help you. Again, I have big sister syndrome. My little sister is quiet and is all about what the doctor said. And I'm like, no, no, no. I want to go to every doctor's appointment with them because I want to know the answers and I want to advocate. So I think the biggest thing is don't be afraid to do that.
And I love that you said that, Whitney, the doctor said, because I've heard that a lot where someone just relies strictly on whatever the doctor says, not remembering or realizing that they are the expert of their lives and not necessarily this outside individual. And that if something's not sitting right with them, it is okay for them to advocate for themselves. And if you don't feel comfortable doing that, get you a Whitney.
Everybody's got one somewhere.
Yes, get you a Whitney. I used to, when I was working in the community, there would be certain social workers that were like, you ride or die. And I'm like, man, I want you to be my social worker. And that while you were talking, I was thinking, I want you to be my Whitney. I want you to be my Whitney. Because absolutely, don't be afraid to advocate for yourself. And if you're scared, get you a Whitney. Because girl, you are amazing. You are amazing. And so thank you, darling. Thank you so much for joining us today and sharing your insights, your passion, and your dedication to serving older adults and their families in our community. The work you do, from helping people navigate Medicare to protecting them from scams and supporting their access, is truly life-changing. So thank you so much for the work you do. And to our listeners, This episode is part of our Remember Me special series leading up to our film screening and community gathering on November 1st at the Central Alabama Aging Consortium. I will make sure to put CAAC's link and the link to register to the Remember Me event in the podcast description. And thanks always for listening to the Goddess of Social Work podcast.
Thank you for listening to today's episode of the Goddesses of Social Work podcast. We are glad you were here. If you like this episode, please come back to hear more stories of the journeys through social work, and please leave us a review on Apple or Spotify. See you next time here on the Goddesses of Social Work podcast.